This November, Proposition 139 will be on our ballots in Arizona. This is a proposition to pass the Arizona Abortion Access Act that would amend our state constitution to name abortion a fundamental right. This act would prevent our representatives from passing any other limits on abortion in our state. If Prop 139 becomes law, it will change our current limit of 15 weeks to allow abortions to be performed through all 9 months of pregnancy. It would legalize abortion up to the point of viability, meaning 24 weeks or 6 months pregnant for any reason. But Prop 139 also makes a broad exception allowing abortions up until the point of birth to protect the mental health of the pregnant individual. This exception, as well as an exception to protect the life or physical health of the mother, is supposed to be granted by the good faith judgment of a treating healthcare professional. But this condition can never be met because there is no good faith judgment that would justify a late-term abortion. First, late-term abortions are never medically necessary to save the life of the mother. Abortions carry many medical risks and do not protect a woman's health. Second, abortions do not protect mental health, but inflict lasting mental and emotional wounds. An abortion is not merely an early or preterm delivery. The procedure is to directly and deliberately kill the fetus. Beyond 15 weeks of pregnancy, an abortion must be done surgically by dismembering the fetus alive and scraping her from the womb in pieces. This is never an emergency procedure to save a dying mother because it takes 2 to 3 days to dilate her cervix to remove the fetus. By contrast, a C-section can be completed in under an hour. If a woman has a true medical emergency and a preterm delivery is needed to save her life, it is never necessary to kill the baby first. In such a situation, both mother and baby deserve care and compassion. Legal abortion is the 5th leading cause of maternal death in the United States. Complications include infection, embolism, uterine perforation, cervical injury, and shock. Women who have abortions have a 40% greater risk of breast cancer. Abortion does not protect women's physical health. Abortions do not protect the mental health of pregnant women. Abortion leads to higher rates of long-term clinical depression in women. Aborting women are significantly more likely to require subsequent psychiatric treatments for neurotic depression, bipolar disorder, and even schizophrenia. According to a 2011 article published in the British Journal of Psychiatry that reviewed 22 major studies between 1995 and 2009, women who obtained abortions were 35% more likely to commit suicide compared to women who carried their babies to term. It is a terrible thing to suffer the death of your unborn child. I know this from personal experience. This is my baby, Juliet. She died at 40 weeks gestation of unknown causes and was delivered stillborn on May 20th, 2021. I will carry her loss for the rest of my life. Though unborn, she was a real baby, my daughter, worthy of love and protection. Babies in the womb are not less valuable than babies outside the womb. Prop 139 would enshrine the killing of an innocent baby as a fundamental right. The Abortion Access Act is not about protecting women, it's about killing their children. Think about babies like my Juliet, and the pain of mothers like me who mourn the loss of their infants. Think about the women and their babies who will be the victims of late-term abortion. Vote no on Prop 139 this November.